Hundreds of thousands of people are at risk of losing their health care coverage in North Carolina. That includes nearly 50,000 people here in Wake County. Less than 2 years ago, the state passed an expansion to Medicaid, giving low-income families access to health care. Access that is now in jeopardy. WRAL's Sean Gallagher shows us how decisions in D.C. could impact here.
For the last 18 months, more North Carolinians have been able to go into primary care facilities like this for their health care needs. But soon, they may be locked out if these proposed budget cuts go through. A short-lived celebration in the Tar Heel state. Expanded Medicaid coverage is on the brink of being eliminated.
But I'm telling the president that you have been misinformed. You supporting the Senate mark will hurt people who are eligible and qualified for Medicaid.
Senator Thom Tillis fears how devastating this could be to the people of North Carolina. In 2023, the law raised the salary threshold for eligible families from nearly $25,000 to nearly $37,000 for a family of three, allowing hundreds of thousands of people to get health care.
All right, so what do I tell 663,000 people in 2 years or 3 years? When President Trump breaks his promise by pushing them off of Medicaid because the funding's not there.
Well, he is just wrong.
White House Press Secretary Caroline Leavitt shot down Tillis's concerns Monday.
And that will therefore strengthen and protect those benefits for Americans who need it, as well as cutting out the waste, fraud, and abuse.
This is a cut to North Carolina's Medicaid program, and it's not just waste, fraud, and abuse.
The North Carolina Health Care Association says the expanded Medicaid benefits over the last 18 months are already showing positive trends. As one example, he says emergency room overdose visits are down 29% and OD deaths down by a similar number. One of many areas he's concerned about if funding changes.
And there's no way you can sugarcoat it. If this goes into effect, it will be a cut of $38 billion over a 10-year period for North Carolina's Medicaid program. And that's not waste, fraud, and abuse. That's direct services to the people of North Carolina that will be in danger if the Senate version of House Bill 1 holds up.
Dobson tells me the NC Healthcare Association is advocating for the House bill because it would essentially freeze Medicaid as we know it. He says it's not perfect, but some 660,000 people wouldn't have to go elsewhere for health care coverage. In downtown Raleigh, Sean Gallagher, WRAL News.